Say most important thing for anyone watching, no pre-cleanse. These ultrasound probes do not use pre-cleanse on them. It's not an approved cleaner for the ultrasound, so no pre-cleanse. If you feel that wire, feel how smooth it is?
Yes.
Okay, so if you feel this, I can tell accounts that have used pre-cleanse because when they spray the cords, it leaves it sticky and tacky, and because the pre-cleanse material it's like literally eating away at the cord, and it will cause the matching layers to dry out, and it'll eventually cause this to like flake off, and this is what creates the crystal. For probe care, just like skipping around just a little bit, don't drop these on the floor. Make sure that if you're plugging them in, that the matching layer is like fully intact and that it's not peeling up, that the cords themselves, I'm just gonna unlock this from here, that the cords themselves are attached to the probe. If you are gonna clean it, the immersion point is right here. Everything from here to the end of the probe can go underwater. From here to here cannot go underwater. If you're worried about water getting on it, you can always put a glove over the end of the probe to make sure that it doesn't get wet. These can be wiped off with the PDI wipes. They can be either the purple top, the red top, the green top, or the gray top. Inside the OR room, like when they're dirty and they're being used, you can wipe them off and then put them back in their case, and put this on top of the cart. And if you're gonna clean the pre-cleanse, you can spray everything off in the cart with the pre-cleanse, then put the ultrasounds in last and put them on the top shelf that you can, so that it doesn't get any drippings of pre-cleanse going down on the ultrasound probes. The connectors cannot get wet, so no getting the connectors wet. Also, if you're one is going to be plug the probe in. So you have 4 live probe ports that you can plug the probe into. These 2 are dummy probes, and I put do not use over here on this side because they're not live active ports. This, just very gently, you're going to put this in right here, just very gently, and you're going to go from unlocked down to lock the probe in place. I already have the ultrasound system on, obviously we can see, but the power button is right here. So this would power the system up. I have number 3 as patient information because when the system gets powered up, it defaults to the patient information page. Doesn't mean you have to put patient information in there, just you have to get past this page. So I put that as step 3. You can, if you're going to put patient information in, there's a virtual keyboard, but there's also a physical keyboard. It's a lock release. You have to actually push the board towards the system and pull it down, okay? If you just try to pull it out, it's not gonna come out. You just have to push it towards and it will come down. If you're not putting patient information in, you can use the trackball to come over to the start button and you can hit enter, or you can just hit the freeze button. And then number 4, if you're going to remember anything besides don't use pre-cleanse, number 4 is select the probe and preset. Don't leave the touch screen looking like this, okay? Make sure that you touch the preset so that the touch screen looks like this, because this is where all your options are to adjust the probe, and the settings that the doctor wants that are set up for that probe are in the preset. So if you wanted to go back out to the probe page, you can hit the probe button and you can select the other probe. You're not probably going to have 2 probes plugged in at the same time, but if you were and you needed to switch back and forth between there, I'm hitting the probe button right here to switch to the preset. If for some reason somebody decided they wanted to go back and do patient information, this patient information button will take you back out to the patient information page. I'm just gonna hit start, and we're gonna select the preset. That gets you going with the doctor. The 2 most common things that they are going to ask for is the brightness gain The overall brightness, if you turn it to the right, it's gonna make the image brighter. If you turn it to the left, it's gonna make the image darker.
Okay.
The depth, if you turn it clockwise, it's gonna come closer to you. Counterclockwise will go further away from you. There are two types of brightness, and I've gotten in the habit of keep it in the middle, because sometimes people will get bored. And I've actually gotten phone calls where somebody's said my probe is broken, or there's a line there and I can't get rid of it, and it's just somebody was playing with the TGCs. So just keep them in the middle. Or I've gotten calls where this is blacked out and everyone's like, oh, I can't see an image. It's like there's something wrong with the system, and it's really just the time gain compensation needs to be in the middle of the system there. A few other things. CF stands for color flow. So if somebody wanted to see if there's a vessel or if something does or doesn't have flow, it says color right there, color flow. You can move it around with the trackball, or you can hit enter and you can resize the box and make it bigger, smaller. PW is the pulse wave, the sound. They're probably not going to use this, but it is available if you want to. You can hit for the sound, and that can show like whether it's an artery or a vein. B is back to basics, or basically will back you out of whatever you're in. If you freeze stops the image. White is a live active image. When you press down and it's blue, it's a frozen image. You can hit store. Store is only storing it to the hard drive. If you hit print, there is a paper printer down below that will have paper that will print out. If you need to change this, you can hit open, and you can get more paper from materials management or whatever, and you can just put this in here and you can close that up. That's how you change the paper down there. If you want to measure something, caliper, if you hit the caliper button, you can hit enter. That would be the height of something. If you hit the caliper button again, you can do a height and a width, and the measurements are right there. You can always store a picture. When you unfreeze it, the calipers go away. And oh, if you needed to store a picture, like besides printing it out, if you wanted to put it to a USB, if you hit review, it will take you into the hard drive. This is already lit up. If you put a USB in here, and there's also USB on the side over here, you can always hit USB PC format, means that it can be read on a personal computer, and copy USB means that it can go to a DICOM viewer if somebody wanted to send it into the PACS.
Okay.
That's cool.
Yeah.
Alrighty.
Yeah, and it can like if IT gets involved, I can have this electronically send to Epic or the PAC system if they ever want to go down that road. I do have some ORs that do that, and this is fully capable of doing that. I don't have that information yet, so I would stick with the paper printer or a USB.
Thank you so much.
You're welcome
How long
so
have we
much.
had this here?